All right, so members, just to bring everybody up to speed, we are on the motion to adopt the conference committee report. There is a roll call on, and we're also under call. So, Representative Abler.
Oh, thank you, Mr. Speaker. And I just have a few extra comments to offer that I was working on over the break, and maybe Representative Atkins can yield at the end of this and answer a question for me. So and I've offered my thoughts about this earlier, and I'm not going to repeat any of those, but so what's in the name? This was the Health Information Exchange, and in the beginning it was the HIE, but then it became the HIX, and there's a slogan, nix the Hicks. That was kind of catchy. And now it's the Minnesota Insurance Marketplace. And so I suppose on our side we'd be saying dim the MIM, would that be the slogan that we would be going at? And but during the conference time, one of the staff pointed out it's actually going to be called the Minnesota Online Marketplace, because who can hate your mom? So I think that's just some marketing advice. And so maybe that's not really a question, but members, we're going to express some more opinions at tonight. I think it's pretty clear how the vote's going to go. I think we've had 395 amendments in this bill, which is, I got to say, I was kind of glad to have the last amendment. That was sort of cool. And I think it was an important one about at least presenting a budget. But it's been a really, really long week for a lot of us sitting working on this thing till midnight. And it's been a long week for deadlines. And so if I could offer any advice, everybody should talk who wants to talk. But if the point's been made, we know the point. This thing's not going to be changed. This is going to pass. We've done our best to make it as good as it can get. And I really hope it works. I really, really hope it works. And I hope that my concerns are unfounded about that. And so thank you, Mr. Speaker.
Representative Loon.
Thank you, Mr. Speaker and members. Well, first, because I like to offer up a note of thanks for the people who worked on this, I want to say thank you, because I know it was a lot of hard work. To the author, to the conferees, I want to especially thank Representative Abler from our side of the aisle for his valiant efforts, I think, to try to make a Minnesota exchange work well for the people who are going to be impacted by it. Individuals, small business markets, other people who need to go to the exchange to get their health insurance. But unfortunately, what we're going to see tonight is, I predict, a partisan vote completely. And it's unfortunate, and I think very telling when you look at who is not in favor of the proposal before us tonight. And I commented on this before it went to conference committee, and I had hopes that it would come out a little bit different. But as a member who has stood on this floor arguing for some relief for small businesses and individuals in the fully insured marketplace who have had the hardest time accessing insurance for themselves and their families, and groups representing those people who were in favor of a Minnesota exchange. They didn't want a federal exchange. They have been behind this, even when other folks have pushed them. They have not been able to come to the table at the end and be supportive of this, and that's unfortunate. So we're going to have, at the end of the day, a product that is endorsed only by one party, by Democrats. And I can't remember the last time we had a bill before this body that was for small business in some measure that didn't get bipartisan support. And I'm predicting this is going to be one of those. So if you don't think that's impactful, think again. Because not one of us talks about small business being somehow unimportant or non-consequential to the people we represent in our districts, no matter what your district looks like. But those folks are not happy with the product that is being brought to them on the floor tonight. They look at this and say, every time there's an idea for some type of coverage mandate that we have through our insurance system that goes through, it falls on that small group and self-employed and individual marketplace. It doesn't fall to the large employers, doesn't fall to the self-insured. And it's the same thing with all of the taxes and assessments that are put in place to carry the burden for whether it's the Affordable Care Act and now on down through to the exchanges. We're continuing to add taxes and burden onto those same people. And they're throwing up their hands and saying, enough, enough. We can't afford it already, and now you're going to pay for this by taxing the same people who can't afford the insurance in the first place. So again, we're at the end of this process. I know we're going to take a vote, but I really hope by some miracle here that this is going to work better than I think it's going to, because again, when you have folks who are desperate for the help, who have been desperate for something to make insurance more affordable, who wanted a Minnesota exchange even when folks who are generally allied with them politically and working on their issues, they've broken with them and said, even if you're not for this exchange, we are, because we need to do something for Minnesota businesses, small businesses and individuals. They have said this product is not going to help us. It's going to cost us more. We are adding on to that burden to the tune of millions of dollars. Some of the statistics I have that, if you look at what large and self-insured businesses are going to pay for some of the taxes and assessments for health insurance, for mandates and other types of coverage, 2.86%. Compare that to the small business marketplace of 13%. 13%. A vast difference. And we have done nothing to lighten that burden. We've talked a lot about the principle of active purchaser and what that may mean. And I'm no expert in that area. I just generally think that more choices are better, but they've raised concerns about that issue. They've raised concerns about the oversight. I must say, from a good government standpoint, having some legislative oversight over a budget this large seemed like a no-brainer to me. We really ought to be having that. I'm hoping the legislative auditor is going to take a very active role in looking at the operation of the exchange, but it's unfathomable to me that we are not going to have some specific oversight through a legislative committee that's established here in the legislature through that on a very regular basis, and approval of that budget. But members, I know the hour is late, but as somebody who has fought to try to reduce some of the impact of mandates on small employers in the small group marketplace, and has offered amendments that have successfully passed on a bipartisan basis, because friends on the other side of the aisle have joined with me and other members to do that. This is a very telling vote today. So, I think we all better be prepared to go back and talk to our small businesses about why we weren't able to come together and produce a better product, the one that's going to get votes from both Democrats and Republicans today, because I think they deserve better.
Representative McDonald.
Thank you, Mr. Speaker. Members, my small little mom and pop shop in Delano has been a member of the Minnesota Chamber of Commerce for 25 years. Still a member. I was president of it for a couple of years in Delano. I also was a member of the NFIB, National Federation of Independent Businesses. And I met with the representative from the NFIB, and he gave me some information that I have to speak about. The state of Minnesota will spend over $165 million to build the exchange, and we all know this. I said it earlier last week, several of us said it, and over $60 million per year to run. So that's a lot of money. I'd be foolish not to represent my 40,000 folks from Wright County, not to say that it seems awfully expensive, but my thought was validated by the NFIB, who I would have to say is a very accredited and respectable organization, because they represent thousands of small Minnesota family businesses. Anyway, they said in their statement, and I passed it out earlier on the House floor, you all should have received it, says that compared to Colorado, who's similar size to the state of Minnesota in demographics, that their state exchange only costs $22 to $24 million per year. And ours is going to cost over $64 million per year. So our exchange is excessively expensive, and it's really hard to believe and hard to quantify the cost. So right now we know for sure that it's $160 million to build and $64 million per year to run. That is astonishing. So I'm just a small town businessman from Delano. What the Sam heck do I know? I'm a photographer, not an exchange expert. So I sought the experts. I sought a fella here that from the Office of Legislative, or OLA, to get his opinion on how much money is spent on the OLA. So if Representative Atkins, I have a question for you, and sorry to interrupt your conversation with Representative Liebling.
Representative Atkins will yield. Representative McDonald.
Thank you. There's a gentleman that we all know. His name is Jim Nobles, our OLA chairman, if you will. And I asked his permission if I could use his name. And I said, say, Jim, would you keep an eye on this exchange? Do you have any insight on it? What do you think about the cost, the scope of the project? I'd like your advice. I need advice before I'm able to speak on it, before I'm able to vote on it. And he said that, he said, and I quote, the amount of money spent on the exchange is staggering. Staggering. From Jim Nobles. Representative Atkins, would you agree with me in saying that that Mr. Nobles has great authority in his position when overseeing and auditing several programs and several agencies in our state?
Representative Atkins.
Mr. Speaker, Representative McDonald, of course I'd say that Mr. Nobles has great authority. And for me, I mean, if you're talking, I think I got like $75 in my pocket. That to me, when I was younger, that's a staggering amount. So when you talk about the kind of money that we're talking about here, absolutely, it's very, very significant, and I appreciate you noticing that.
Thank you, Representative Atkins. Mr. Speaker.
Representative McDonald.
Thank you. Let me read something to you. It says, this is kind of a little off topic, and I'll get back to Mr. Nobles, who also said that they will keep an eye on all the expenditures, because it's staggering, an eye on the lots of data issues, which is staggering. It should concern you that we're losing our privacy data, our own individual personal records, medical records. That should concern you. And lots of money. So I want you to guess who this was written about. More affordable health insurance options. Joe was recognized by the National Federation of Independent Businesses. That is this letter that was passed out. It had McDonald on it with a little shamrock because St. Patrick's Day is coming up on Sunday. Joe was recognized by the National Federation of Independent Business for passing a bipartisan law to provide more flexible and affordable health insurance options for individuals and small businesses. No, that wasn't Representative Joe McDonald. That was Representative Joe Atkins, who gave you kudos, Representative Atkins, for your great work in health care. But unfortunately, what your bill is doing is costing way too much money, so much that the Minnesota Chamber of Commerce, who I'm a member of, my little mom and pop small shop in Delano, who used to pay my own health insurance until I got elected to this position, and I'm very grateful to the 40,000 members in my district who sent me here, because they used to cost my wife and I over $850 a month for our health insurance until I got elected here. And I'm thankful for those who put me here, because it's a lot less than that. But for my fellow businesses who are back in Delano and Howard Lake and Montrose and Waverly and Rockford and South Haven and Annandale and, did I say Howard Lake? I don't want to miss anyone in my district. And the townships, those independent businesses, they'll cost them a lot more than that per month once your bill, Representative Atkins, is passed here at St. Paul. So the Minnesota Chamber of Commerce says this, who I respect, and I'm sure that most of you do. They say this, and you got it too, but I'll repeat it just for the sake of it. They say that the House File 5, Representative Atkins, that's your bill, who the NFIB heralds you for being a great independent business supporter in bringing down the cost of health care. The Minnesota Chamber of Commerce says this. They believe, and I would have to agree, that this will increase taxes on small businesses and individuals. Now, there's one thing that I ran on kind of the placard of my campaign back in Wright County, is I want to come down to St. Paul and fight for small, independent businesses and families. And if I'm not able to do that, then you boot me out of this seat. So if I don't get up and speak tonight, folks, on behalf of small businesses, which I am one, and thousands are in Wright County, and so is Joe Atkins. He's shaking his head. You're a small businessman too. Thank you. That's great to hear. Then you should be voting no on House File 5. Because the Chamber of Commerce says that this will increase the cost for small businesses and individuals. Surely you don't want that. Did you know that in Colorado, that they established the exchange for 4 times less than the state of Minnesota? We ought to be ashamed of ourselves spending the taxpayers' money so foolishly. They're going to fund that with premiums to the insurance companies by only 1.4%. Do you hear that? Google it for those who have a smartphone or a fast iPod or iPad. 1.4% is what Colorado will increase to their insurance premiums to pay for the exchange. But no, Minnesota is going to increase it by 3.5%. And what that does, folks, according to the Minnesota Chamber of Commerce, and you'll all agree with me, I'm sure, that they are a pretty credible organization, since they make up for most Minnesota family businesses and mom and pop shops. They say that it'll increase taxes on small business and individuals. Representative Atkins, that is you and me and thousands of Minnesotans. We ought not to vote for that. They also say that it limits consumer choice. Well, that ain't good. As independent businesses, you know that more choice is good. We should be ashamed of that. And then, let's see, also this, too, will have a long effect. It infringes on our individual privacy records. So, Mr. Speaker, I would like to, with your indulgence, to read something for the folks here. It says here also that Representative Atkins on his website, State Representative Joe Atkins, you've got a great website, by the way. Puts mine to shame. I'm going to have to put a little more work into mine. It's really wonderful, very informative, very user-friendly. That's a good thing in social media, user-friendly. Says that Joe believes doctors and patients should be making important health care decisions, not HMOs. Well, folks, I wish that was the case, Representative Atkins, because with your bill, guess who's going to make that choice? A 7-member board will make that choice for you eventually. That's who will make the choice, not you. When you say that doctors and patients should maybe be making important health decisions, it won't. That'll be lost with your bill, unfortunately. And that's not good. So just a couple more things. I'm not going to speak forever. Let's see. Oh, don't laugh now here. Hang on, folks. Sorry, pardon my intentions here. Where's Representative Lenchiski? You had some great things, Representative, about affordable health cost. If I could find it here, doggone it. Hang on, folks, hang on. Let's see, controlling health care cost. Is this considered a prop? Boy, if it is, my apologies. Representative Liebling, you said something too here. Oh, Lenchiski, here it is. Lenchiski, okay. Representative Lenchiski, you sent out a survey. Good thing to do as state representatives. We must always gauge the importance of our constituents back home and realize what's important to them. Wouldn't you agree, Representative Ward? Don't you think, Representative Clark? Very important to listen to the folks back home who sent us here to speak on their behalf. Wouldn't you agree, Representative Murphy, that we listen to the folks back home? Guess what your folks back home, Representative Leszczynski, excuse me. I need a glass of water. Nothing? Okay. So, Representative Lachinsky, you sent out a survey in 2009, and you wanted to find out, you wanted an overview of your priorities and ranking them by the top 3 issues that are most important to those great folks in Bloomington. And would you believe it? The Mall of America is not their number 1 priority. No, their number 1 priority, thank you, Marion. And Mary, their number 1 priority was lower health care costs in your district. 36.7% wanted you, Representative Lachinsky, to come down here to lower health care cost. Isn't that something? Their second thing was, at 18.7%, was job creations. Folks, I haven't seen a job bill on this floor since we started January 4th. Did we start January 4th? Not one bill have we passed here regarding job bills. Not one. I think we ought to be ashamed of ourselves. So, Representative Lachinsky, your folks wanted you to lower health care cost. Well, guess what? Tonight you are going to vote, I hope not, in favor of House File 5, which will increase the costs of health care. Not just, I don't say that, Joe McDonald. What do I know? I'm a photographer. I'm a small independent businessman who belongs to the NFIB, who they say will increase the cost of health care, reduce your coverage, your choices, give up your personal records of privacy. We ought to be ashamed of that alone, let alone the cost. So no, not just Representative Joe McDonald says that. I repeat, NFIB said it, and they're pretty credible business here. The Minnesota Chamber of Commerce says that too. They say that Representative Lachinsky, if you vote in favor of House File 5, which 36.7% of your residents say they don't want, they want lower health care costs, you will increase the taxes on small businesses and individuals. Is that what you want to do? Now, I didn't ask you to yield for a question yet. And I'm sure that you want to answer that, because you're quite bright, being the chairman of the tax committee and all. Worked with you last year on the property tax. You were very good. You and I got along, and I appreciated your insight. But I'm afraid you're not right on this one, because I think you're going to vote in favor of House File 5, and you will vote against 36.7% of those who you represent. That's too bad. Okay, what else? Let's get back then. Did I go 10 minutes or 15 minutes? Once I hear everybody talking, I don't want to overextend my stay. Let's close with this, folks. Let's close with this. Because I got data here, you got papers galore, write down things here, and NFIBs, and you got the iPad here to talk about issues. Representative Liebling, I pulled some things on you too, but I can't find them anyway, so let's just say this. Jim Nobles, who is our auditor, who we hold a lot of credence, we respect, we admire, we listen to by a nonpartisan basis, says this, and I'll repeat, Representative Atkins, that and I asked his permission. I don't just say this just without, throwing him under the bus. That's unfair to do. So I did call him and ask him, just for the record. And he's a great man. That we're going to keep an eye on it being House File 5, the next exchange, because it's very expensive. They have a lot of data issues. It costs lots of money, quote, end quote. And in closing, Representative Atkins, and you're a businessman, you should know better. My goodness gracious, you should know better than this. It's staggering, the cost to our local small businesses and families. And it have years of devastating, damaging results for me and my little business and 40,000 other folks in my district, because that's who I speak for. So please vote no on this. Please vote no. And with that, Mr. Speaker, parliamentary inquiry.
State your parliamentary inquiry.
Mr. Speaker, when would be a good opportunity to recite a proclamation from the state of Minnesota, from our good governor of the state of Minnesota, that states that professional photography is an important tool in documenting and preserving our heritage and history for future generations to enjoy. And whereas professional photographers capture
Mr.
precious
Speaker,
moments,
parliamentary inquiry.
including
Representative
births,
Winkler.
Mr. Speaker,
weddings,
is it within the rules
graduations,
to read from documents on the House floor?
confirmations,
Representative
and
Winkler.
milestones. I'm sorry, Mr. Speaker.
Representative Winkler is risen to a point of order.
Parliamentary inquiry, is it permissible under the rules to read from documents on the floor?
Representative Winkler, no, it's not.
Mr. Speaker.
Representative McDonald.
Thank you. I was just simply asking a question of parliamentary procedure. I have a proclamation from the good governor of the state of Minnesota, and before I sat down, I wanted to be able to read his proclamation, since he is our good governor of the state of Minnesota. So you wouldn't have to hear from me for the rest of the night. So that is the question, Speaker.
And the parliamentary inquiry is actually against the rules to read from a document on the House floor.
A proclamation from the governor of the state of Minnesota? Ladies and gentlemen, please vote no for House File 5.
Representative Gruenhagen.
Thank you, Mr. Speaker. Thank you, members. We're looking at basically four things here that are of concern. We have no guarantee of privacy. All of us are aware of the problems with government handling private information. All right. Number two, the high cost. Number three, less access to our medical providers. And finally, this is, in the end, is going to become a democratic exchange. Okay? And so I hope it works for you, because I have serious reservations. The other thing is, I have a lot of respect for many of you. I have come to like some of you. I don't know if the feeling's reciprocal, but this is my last swing at this bill, ladies and gentlemen. And Representative Atkins, no offense taken, but I'm going to get a little pointed, okay? Because this is the last time where I have the convictions about this bill that it's going to damage one of the best health care systems in the world with stinking growth of government. That's a bunch of nonsense. Now let me just get into a couple. First, I want to address cost. The Chamber says cost is going up. The NFIB says cost is going up. Even the IRS says the cheapest health plan for a family of 4 to 5 people is going to be $20,000 a year by the year 2016. Yet Representative Atkins on this floor stands up and says the Massachusetts Exchange, the premiums have actually gone down. Well, I thought about that, because all I've received is information that the premiums have gone up. They've got like the second or third highest health insurance premiums in the nation. And I finally figured out what's going on. That New York Times article, and I need to double check it a little closer, but I got some information during the break. That New York Times article, they count the subsidy of the insurance premium to figure the decrease in the rate. So they're taking tax subsidies to figure the rate of the premium versus what the actual premium is. Well, you still got to take that money from somebody else. You've got to take it from an individual or a small business. That doesn't lower the premiums. So we see costs skyrocketing. Second thing, is the history of government-run health care projected cost very good? Is it even close? Well, if we look at the exchange, we see that the original estimate was $969 billion. That grew within a year to $1.7 trillion. And now it's estimated at $2.7 trillion, and it hasn't even been implemented. There's an estimate out there, by the time it's implemented, it'll be over $6 trillion, ladies and gentlemen. $6 trillion. Let's look at what the estimates were for Medicare and Medicaid. In 1968, Medicare cost this nation $6.8 billion. It was estimated to cost $10 billion in 1990. So from 1968 to 1990, the government estimated that the cost of Medicare would be $10 billion. It would grow to $10 billion. Do you know what the actual cost was of Medicare? By the time 1992 came, it was 136 billion, members. More than 10 times more than what any estimate was. Today, Medicare has grown to over $431 billion per year. So government-run health care grows exponentially, much faster than any estimates. We look at Obamacare. What do we see? 969 billion, 1.7 trillion, 2.7 trillion before it's even implemented. It's going to bankrupt this country. Now, why has government-run health care and Medicaid, by the way, between 1968 and 1990, total federal spending without government-run health care went up by a multiple of 8. But government-run health care went up by a multiple in Medicare of 1,100%. So total federal spending went up by a multiple of 8. Government-run health care went up by 1,100% between 1968 and 1992. Medicaid went from 3.54 billion in 1968 to over $108 billion by 1992. That is a 3,000% increase, members. Think about that. 3,000. And Obamacare is growing at a faster rate in terms of cost than Medicare and Medicaid did at a time when we have our baby boomers retiring. The reason Medicare and Medicaid worked is because we had the 77 million baby boomers, and we had older people with not as long as life expectancy and a smaller retirement group. That's completely inverted now. This is economic insanity to continue to promote government-run health care in the form of the exchange in Obamacare when our country is $16 trillion in debt. Please, for the sake of your children and grandchildren, think about what you're doing here today. We need to send this back to conference. We need to have it trimmed down and make it more flexible. You don't have to do it the way I say, okay? But at least listen to Jim Abler, all right? He's halfway, he bends a lot further than I would. And again, I'm not just saying it for myself or because I'm a Democrat, a Democrat, yeah. I don't know if you'd want me to tell you the truth. I'd have to take a lot more medication than I'm taking currently, let me tell you. No, I'm sorry about that. Okay, so members, government-run health care is a financial disaster. And you know what this exchange reminds me of? The stadium deal. A bunch of fudged up numbers on $1 billion deal, loading up the taxpayer for the bill, and then saying, well, this is going to be a good deal. Well, we all know what's going on down south in a different state, all right? Here, we gave one of the best deals in the whole nation and in the history of this nation. And the taxpayers picking up the tab at a time where we got a recession and we got people being homeless and not being able to eat, but we got plenty of money for Ziggy and the boys. And some of the boys act like a 2-year-old, worse than a 2-year-old brat, to tell you the truth, okay? They're high-priced brats, some of them. Not all of them, but some of them. And then we subsidize. Now, I can understand why the governor and yourselves, many of you, want to tax the rich. When you give Ziggy a $400-some million subsidy, well, we better raise taxes. The problem is Ziggy will figure out how to get out of it, and we'll be hitting our job creators. Okay, now I'm going to get to the controversial things. Okay. Thank you, Mr. Speaker. You know, we got a 9% problem in this state. Okay, 9% unemployed. That's by our agency here. 6% of the 9% already qualify for a government program. Think about that. 6% of the 9%. So we got a 3% problem. And I asked in committee during the testimony, I said, those 6% are not signing up for government programs now. How are you going to get them to do it? And you know what the response was? We're going to send the IRS after them. So we're going to SIG IRS agents after the uninsured to get them to sign up for health insurance. That was the response. I asked it 2 times. It finally came out, well, the IRS is going to go after them. Is that what you want to do, members? SIG IRS after our poor people to sign up for a health insurance plan? Does that make any sense whatsoever? And I think under Obamacare they want to hire 15,000 additional IRS agents. That's ridiculous. We should be streamlining the IRS, not bloating it. Okay, we're back to choice, cost, and privacy. Okay, now on to my next point. I just want to go back to this poor foster care business owner who's basically going to get put out of business. You know, here's the deceitful thing about Obamacare and the exchange. It reminds me to a certain degree of the Part D drug program that's available for seniors. You know, when a senior comes into me to sign up for a Medicare supplement, I tell them you don't have to take the drug program. It's voluntary, okay? But then I quickly add, by the way, if you don't take the drug program, the government's going to impose a 1% penalty per month for every month that you don't take it. So if you suddenly need some high-priced drugs in 3 years, you're going to have a 36% permanent penalty on your drug program. So do you want to take the drug program? See, that's government freedom of choice. So Representative Atkins can stand up and say, well, it's voluntary, and then we can go to the foster home, and sure, it's voluntary. But if they don't provide the health insurance for their employees, they're going to pay a $2 million penalty. 2 million members. That's the type of freedom and choice government gives you. It's a choice that they can talk out of both sides of their mouth at the same time. And that's despicable, because in effect, it isn't a choice. It's a, you know, I grew up with a dairy farm. How did we get cows onto the stock truck when they didn't want to go? We gave them one with the electric shocker, and then they went. That's exactly what the government is doing to us, all right? With their mandates, and then they stand in front of us, speaking out of both sides of their mouth, saying, it's a choice. It's voluntary. It's a choice. Oh, by the way, if you don't do it, we're going to penalize you. Is that the freedom that we've had in this country based on our Constitution and Declaration of Independence? Okay, when I read this from the foster care, one of the testimonies that we had in committee, and I'm close to wrapping up, Mr. Speaker. You want me to keep going? Okay. Hey, I could stay here all night. I'll talk till everybody leaves but me. No, just kidding. Okay.
There's a white flag over there.
There's a white flag? Are you going to go along with me? Now, you know I like a lot of you guys, okay? Okay, especially Representative Winkler. He irritates the daylights out of me, but I do like him. Okay, testimony from Catherine Commit from the Minnesota Council of Health Plans, who, by the way, is not endorsing this. You know what her testimony was in the HHS committees, and I heard it twice? This exchange might actually produce more uninsureds, okay? Why? Because companies like, or businesses like the foster care will cancel their insurance, and then people will have to be forced to go to the exchange. Many of them won't qualify unless they get divorced and file separately, and I brought that up last time. So, you know, there was a cartoon on the internet. It showed two women talking, and the one said, hey, my employer has to give me health insurance. The other one replied, yeah, my employer does too, but he just gave me a 2-week notice. I'm losing my job. That's what's going to happen, members, with this. You're going to create more unemployment. And look at what it's doing to our schools. Many of you probably have heard from your schools. My school, one of my school districts, $197,000 more a year, or a $218,000 penalty. They're going to have to cut the paraeducators that are helping the kids struggling in order to financially afford that. This is going to be a disaster for our schools, especially rural. It's going to be a disaster for our small businesses, especially those with 50 employees. And where's Representative Seltzer? Okay, I didn't get enough phonics in school, so I was taught whole language, by the way. No, see Dick, Jane, Ron. But anyway, her and I were at a chamber luncheon, and I happened to be sitting by a small business owner. He had 51 employees currently in my district. He figured and calculated the additional cost for his small business for health insurance, $16,000 more a year to cover the mandate that's voluntary from Obamacare. You know what he told me? I will have 49 employees the day Obamacare becomes effective. This is going to drive up unemployment and create more dependency on government. We're back to less choice, higher cost, no privacy. Finally, I'd just like to say this, okay? And this is a finally. Thank you, Mr. Speaker, for your indulgence, okay? As I said before, there's a marriage penalty in the exchange in terms of the subsidy. We had that testified and documented to us in the committees, all right? You're taking a philosophy of government that undermines the traditional family. Why is that important? You're better off getting divorced or living together than getting married, and you'll get more subsidy from the government. I've got the examples if you want to see them. I want to give you one last example. I know I said finally, and this is the last example. And this comes from Focus on the Family. And I just want you to, those of you who will listen, to listen carefully, all right? It's the Leave It to Beaver family. I think most of you remember the Leave It to Beaver family, okay? I definitely do. And that's, you know, Mr. and Mrs. Cleaver, Wally, and Beaver. Okay, do you know what their federal income tax rate was in the late 50s? 2% of their income, members. 2% of the Cleaver family's income went for federal income taxes. Today, if you took the Beaver family and you put them under the current federal tax code, their tax would be 25% of their income, besides all the sales tax, gas tax, and every other type of tax. You know what would have to happen? Because of the high taxes, Mrs. Cleaver would have to get a job, Wally would be into alcohol and drugs, and Beaver would be a latchkey child, and we need all types of government programs to take care of all the problems we got in the society. The point is this, members, the growth of government has had a very detrimental effect on the family, and when you undermine and destroy the family, you cannot print up enough money to take care of all the problems that come out of it. That's what you're doing, members. Your good intentions of growing government in healthcare or whatever are going to backfire. That's why when you try to help the poor, you create more poor. When you try to help the needy, you create more needy. We had testimony from Anoka Hennepin School today. They're going to have poverty children, percent of poverty children in Anoka Hennepin, over 60% in the next decade. Government is a major contributor to that. They're devaluing the dollar and expanding at a rate that is damaging the family, because the family will do for free what you have to pay government employees to do. Not as well. We're back to the closing comment. Less choice, higher cost, no privacy. Thank you, Mr. Speaker.
Representative Scott. You You were on the list before we broke, so.
Oh, yeah, I was. Thank you, Mr. Speaker. Thank you. I didn't know you were, I thought maybe you were starting afresh with a new list. Well, thank you, Mr. Speaker. And, you know, it's hard to go after Glenn, but there are some obviously some very troubling aspects of this health care exchange bill, the Democrat health care exchange bill. And no, there's really nothing democratic about it, just Democrat. But my concern, one of my primary concerns, of course, is privacy. And, you know, there's a Star Tribune article here dated the 13th, so yesterday I believe was the 13th. And one of the paragraphs really distinctly addresses this board and how its hands are going to be so full during the early operations of this massive undertaking. And there's going to be massive amounts of data moving in and out of the exchange. And there will be a steep learning curve as consumers, businesses, health insurers, and medical providers acclimate to the new website and the bugs are worked out. And it goes on to say the exchange needs the state's best thinkers to guide and reassure stakeholders through this make or break period. And so my question is, will the board have the consumer's privacy in mind? Do we have any guarantees that the board will have the consumer's privacy in mind? That's very troubling, folks. This board, as has been said before, non-elected, non-accountable. In fact, in visiting with Representative Abler he said in conference committee that it was almost impossible to get any sort of constraints on this board whatsoever. And the only thing that they ended up settling on was that the board would have to submit a budget. So regardless if they're asking for 5 new copy machines and they really don't need them, there's nobody that can tell them they can't have those. We'll all know about it, but there's not a darn thing any of us can do. So I'm wondering if Representative Atkins would yield to a question.
He will yield. Representative Scott.
Thank you, Mr. Speaker. I know that the conference committee considered having at least one provider on the board, and I'm just wondering why that didn't happen.
Representative Atkins.
Thank you, Mr. Speaker, and thank you for the question, Representative Scott. I think the main impetus or thrust behind that was that we wanted a conflict-free board. There was considerable discussion that went around and around that issue, but the major argument in favor of keeping the board as it is, or with the slight tweak where we allowed somebody from the University of Minnesota or another academic institution to be on it, but to keep the rest as conflict-free was for that very reason, so that there would not be any financial motivation of the folks serving on the board, that they would possibly be even the appearance that they would be serving some other master rather than the consumers of Minnesota.
Representative Scott.
Thank you, Mr. Speaker. Well, what guarantee do we have that they're going to be looking out for the consumers now? If Representative Atkins would yield.
He will yield. Representative Atkins.
Thank you, Mr. Speaker. Representative Scott, the whole point of having a conflict-free board is because that has an even greater likelihood of not serving any other master than consumers. Even if it's solely for appearance, that makes this board appear, and we keep talking about issues like privacy and those sorts of things. The whole point of having a conflict-free board is to have one that solely serves the interests of consumers.
Representative Scott.
Well, thank you, Mr. Speaker. I don't know that really assures me that is the board taking an oath that they're going to uphold the consumer's best interests. I don't see that in the bill anywhere. And I'm wondering, too, Representative Atkins, if he would yield to another question.
He will yield. Representative Scott.
Thank you, Mr. Speaker. In conference committee, I'm just wondering why there was no oversight whatsoever other than the legislative auditor being able to do an audit every so often. Why were there no guardrails put on this board, and did you make any attempts to put a guardrail on this board?
Representative Atkins.
Thank you, Mr. Speaker, and thank you, Representative Scott. I've actually been, over the course of the evening, I've been listening and jotting notes about what people have been saying. I've also been trying to do a little bit of research. Based on my understanding at this point, there is no entity in Minnesota that's associated with the state of Minnesota that has greater oversight than this particular board. With what went on as a result of the conference committee and now a legislative oversight committee, as well as Representative Abler's amendment, which was the very final amendment that went on, the A395 amendment, there is no entity anywhere in Minnesota ever in the history of Minnesota that has greater oversight than this particular entity. So if that's not enough oversight, I honestly don't know what more we can do to protect data, to protect the information, to make sure it's well run financially, the use of the legislative auditor, the legislative oversight commission, all of the requirements federally and statewide. There is nothing more that has ever been done in the history of Minnesota to provide an oversight over any sort of agency or entity.
Representative Scott.
Thank you, Mr. Speaker. Well, Representative Atkins, you haven't convinced me. So in the scenario that I gave, if the board wants to go out and purchase 3 copy machines 1 month after they already purchased 3 brand new copy machines, who's going to tell them that they can't do that? If Representative Atkins would yield.
He will yield. Representative Atkins.
Well, Mr. Speaker and Representative Scott, first I would hope that being good Minnesotans and frugal Minnesotans, that their own consciences would tell them not to do that. And we should trust people a little bit to do the right thing. And maybe that's too much to ask, but aside from that, we expect to hold them accountable to the extent that they're wasting money or spending money that they shouldn't or spending it illegally. That's a crime. It's also subject to the legislative auditor. It's also subject to the legislative oversight commission. All of the very same things that we would expect they would be held accountable for, they will.
Representative Scott.
Mr. Speaker, thank you. Well, it sounds to me like this is the Met Council on steroids. That's what this board sounds like to me. There's absolutely zero oversight. Zero oversight. I hope the people of Minnesota are listening to this. Folks, this bill is, once again, as we've said over and over again, costs way too much, limits our choices, fewer choices, and zero privacy, folks. Look out.
Representative Detmer.
Thank you, Mr. Speaker, and I think most of you know I don't get up very often and speak, but I'd like to just address a positive thing about the DFL Health Exchange bill that we're voting on today. A positive thing. And I would like to take this time to thank, really sincerely thank, Representative Fritz for her courage to bring forth an amendment that was brought forth to the bill. That was one of the couple of things I was able to vote on for this bill. I'd just like to thank her for that. She represents my father in Faribault. My father's 90 years old, and whenever I go down and visit my father, he can say nothing but positive things about Representative Fritz. And I went over beforehand and asked if she would yield to a question, but I'm not going to ask her to yield to a question, because I know, like me, she doesn't get up much and speak either on the House floor. Am I right, Representative Fritz? Yes, I see you smiling over there. But I do want to commend you for your courage. I think everybody know that I'm also pro-life, and probably what you don't know is our twin sons that many of you met. We adopted them when they were 3 months old, and just see how they've turned out after we took them into our family, and how they are serving their country. Representative Fritz, you can take a lot of credit for standing strong with your courage. People tell me when I come down here to vote, there's 2 buttons I can push here. I can push a green one and a red one. And they tell me, make sure when you push that button that it represents your principles and your values, what you really believe in. And I think when I start pushing the button that doesn't agree with my values or my principles, then it's time for me to leave this great place. I was able to listen to the bill coming through two of the committees that I serve on, the State Government Finance and Veterans Affairs, and also the Ways and Means. And then I heard a lot of the debate here on the House floor. But I always looked at four big questions I'd always ask myself. And I even asked them in the committees. And I would ask, where in the bill does it guarantee that the health care in Minnesota will improve? There's no place that guarantees that the health care in Minnesota will improve. Where in the bill does it guarantee that the health insurance premiums will be lowered in Minnesota? There's no place in the bill that says the health care premiums will be lower. Where in the bill does it guarantee that more people will be covered than currently covered in Minnesota? No place in the bill does it say that more people will be covered. Lastly, where in the bill does it guarantee that there will be savings throughout the system in Minnesota? Nowhere in the bill does it state that. Well, finally, this is just another infrastructure bill creating a huge super agency with layers of bureaucracy between Minnesota, the people that live in Minnesota and their health care, and, as the author of the bill stated, it's mandated by the federal government. Thank you, Mr. Speaker.
Representative Franson.
Thank you, Mr. Speaker. Members, when I ran for office 2 years ago, I made a commitment to myself and I made a commitment to my district that I would not vote on anything that would negatively affect my children or my grandma. This bill does that. This bill will negatively affect my children and my grandmas. And you on the other side of the aisle, you hold all of our children's lives in your hand, and also our elderly in your hand right now. When you go to push the red or the green button, it's my hope for our future that you will push the red button. As we have stated all night long, this bill does nothing about choice of health care. The cost is going to rise exponentially. $138 million a biennium in order to fund it, and that's an estimate. 42% increase in health insurance premiums. And we don't even know about the lack of privacy that we're going to experience. This bill does nothing to limit the size, the scope, and the power of government. As a matter of fact, this bill will increase the power of the IRS, it increases the power of the government, and also increases the power of crony capitalism. The Chamber opposes this, NFIB opposes this. 2016, we're going to have the cheapest insurance plan is going to be $20,000. I don't know about you, but when I go shopping for a car, I can't afford a $20,000 car, let alone a $20,000 health insurance plan. So, this is just horrible. So many of you on the other side of the aisle said you were going to run and you were going to work with the other party and you were going to end gridlock and you were going to do what was best for Minnesota. This bill is not it. This is going to decimate the health care that we know and love in this great state. This is not a Minnesota health insurance exchange. This is not a marketplace. This is a federal exchange. All the rules and the regulations are coming down from the federal government. While we may have a 7-member board here in Minnesota, they are nameless to us at this time, and they will be faceless. One of the concerns that I got from one of my business owners in Alexandria was that they want to see on this board of 7 people, they would like to see some rural representation. So I hope that we can get some rural voices on that board in order to best determine the quality of health and the need that we need in greater Minnesota as well. And I also would like to thank those that voted along and actually offered the amendment for the pro-life initiative. And that probably took a lot of courage in order to offer that amendment and also to vote with us today when we decided if we were going to concur with the Senate or not. But think long and hard when you go to push that button. Just remember to yourself, this bill does nothing about choice. It reduces choice. It increases costs and reduces our privacy. And once again, it increases the size, the scope, and the power of government. So I urge a red vote.
Representative Dean.
Thank you, Mr. Speaker and members. Members, this is a very, very important vote that we're going to take. It's probably one of the most important votes of the year, and for freshmen, it'll be your biggest vote, very likely, of the year, and it's one that we've spent a lot of time talking about and thinking about, and it does impact a great many Minnesotans. It impacts every single person in your district and every person in the state, and it will for many, many years to come. This will pass. This will become law. The governor will sign this into law. And for many, many years, people will look back on this, and they will be dealing with this in future legislatures. And it sounds, on the face of it, like a really good idea. Marketplace to purchase health insurance as an alternative to a top-down government control health care idea. It sounds like a very appealing idea. I'm probably one of the few people in this body, probably along with Representative Atkins, who's actually purchased insurance and group insurance for other people. And for small businesses, it's really difficult. It's difficult to get more than one bid if you're going out to try to find health insurance or disability insurance or life insurance for your employees. It's really hard for small businesses in Minnesota. It's getting harder and harder every year. So when you hear about something like this, it sounds like a good idea. And a few years ago, when we were looking at this, I remember reading the Heritage paper, the Moffett paper that came from the Heritage Foundation that really said this is a conservative idea and we need to look at this. And I took that to heart as somebody who wants to make it easier for small businesses in the state of Minnesota to purchase insurance. Because let's face it, right now, for many, many small businesses and families, individual insurance, you can't even buy it, or if you can buy it, it's not really health insurance, it's bankruptcy insurance. If you're paying $1,000 a month deductible, $1,000 a month premium, $24,000 a year, your first $24,000 goes to health insurance, and then you got to pay for everything else. That's not workable, and we know that that's not sustainable moving along. So probably I was more interested in anyone than a health care exchange a few years ago when we started looking at this. But then you look at the details and you say, how are we actually going to do this? How are we going to roll it out? And when you look at what other states have done, that's what a lot of what we do is we say, all right, who's doing this? We're the laboratories of democracy. We're going to try things 50 different ways. That's one of the first things that we do, and Representative Atkins has been talking about that. And he talks a lot about competition. He talks a lot about transparency. He talks a lot about trust. And it sounds very appealing. And Representative Atkins is a very appealing spokesperson for just about anything. And I always, I tell freshmen, beware of Representative Atkins. Because Representative Atkins can swoon you into voting for something, make something sound very appealing. It's like, 46 states already do this, we do this, it doesn't cost any money, it doesn't feel bad, it's going to be great. Oh, that sounds great. What did we just vote for? So Representative Atkins is very, very appealing. We got to be very, very careful because he's very good at that. But you got to be able to look under the details a little bit and just say, what are we doing here? So when Representative Atkins kind of reminds me of this Far Side cartoon. There's this, it's out in the Serengeti, and there's this zebra, and the zebra's laying dead. And in front of the zebra, there's this lion, and he's on his back legs, and he's directing other zebras, and he's saying, "Move along, folks, nothing to see here, move along." So you got to be a little bit careful. You got to look a little bit beyond the detail and say, all right, well, let's take a little bit of a look at this. Let's look at some of these things about competition. And you know, there's a lot of folks on my side of the aisle, like Representative Davids, Representative Gruenhagen, Representative Albright, and others that know a lot about insurance, and I hope you really took that to heart. I don't serve on the Commerce Committee. I don't really understand the insurance aspects like they do. They do a great job. But I'm just going to talk a little bit about health care, because that's something I have focused on in the legislature, and it's something that I'm a big fan of in the state of Minnesota, is our health care system. I want to talk a little bit about competition. I want to talk a little bit about how we're going to move forward, because competition is one of the ways that this has been said that this is a good idea, because this is competition. But I would question whether this is competition between one provider and another provider for my small business friends, or whether this is competition between the government market and the private market. I would submit that it is competition between the government market and the private market. And that's a bad thing, because that makes government bigger, and as government gets bigger in Minnesota, the quality of health care goes down and the price goes up. We know that is true. We want to talk about competition. Are we also talking about Minnesota competing with other states? We also said, hey, you know, we need to do this, because if we don't do this right now, the federal government is going to come in here and do this for us. We heard that? We heard that? The federal government is going to impose a federal exchange if we don't do this right now. Well, we look at other states, as I said before when I spoke on this on the House floor, and we look at North Dakota, we look at Iowa, we look at North and South Dakota, Iowa, Michigan, Wisconsin. The other Midwestern states are not doing this. So you say, well, it can't be that if this is such a bad idea, or to not go with this exchange on the deadlines that the federal government tells us that we need to do, that all these bad things are going to happen. If all of these other states are really not doing exactly what we're doing, do you really think that that is such a cataclysmic idea? I don't think so. When we look at competition, it's Minnesota versus other states. It's private versus public. It's not a good competition like we think about for trying to get better quality for our health care dollars. We look at transparency. Is this really going to be more transparent? I believe Representative Atkins says this is going to be the most transparent agency in the state. How could we have any more transparency? Well, who is watching these folks? I looked at another state. Tried to look at as many states as I could to see what has already passed. And in other states, they have an outside auditor that comes in and audits the books and reports back to the legislature. That seemed like a good idea to me. I offered that up as an amendment. That was rejected. But you might want to think about that. You might want to think, who is actually watching these 7 folks? And let's talk about transparency and trust. Let's talk about trust, because we've got the best health care system in the country. We've got the best physicians in the country. We've got the best researchers in the country. And we don't trust them. We don't trust. Not one physician can be on this board that's going to decide how we're going to deliver health care in the state of Minnesota from henceforth. And you know, we're not supposed to talk about Obamacare, aka the ACA. We're not supposed to do that, but I'm just going to mention that because that's how we got this. It was passed at a federal level, not on a bipartisan basis, but on a partisan basis, rammed through with no Republican involvement, nothing reaching across the aisle. It was rammed through, paid a huge political price for the Democrats for doing so in 2010. Paid a huge price for doing that, paid a huge price for imposing on all of the country a health care system that we can no longer enforce, that's going to drive up our costs. So think about that, this came from. This came from Obamacare. This came from the ACA. It's imposed upon the state of Minnesota. And when President Obama rolled out the ACA in Chicago a few years ago, he talked to the delegates of the AMA, all the physicians that came and gathered in Chicago, his hometown. And he didn't say, you're the best physicians in the world, you are the standard of care for the world. He talked about how much better health care was in other countries. And that's what we're doing here. We're saying we know more than you do, doctors of the state of Minnesota, physicians, clinicians, research folks who come here from all over the world. We know better because we're legislators. You can't be on this board. There's a gentleman by the name of John Hicks. He's a doctor at HCMC. When the bridge collapsed, the people were brought out of the water. They were brought out in terrible condition. They were brought to HCMC. They didn't know what they were facing. They didn't know what kind of injuries they had. They had head trauma. They had surgeries. They did the best they could. They reacted with the best absolute training in the world. Nobody died at HCMC that was brought out of the water or off that bridge that day. And I talked to this gentleman, and I talked to a physician named Walter Glisich, who's a neurosurgeon who operated on patient after patient after patient after patient. Nobody died. And you know what they said? They said, Matt, everybody did their job. Everybody from the nurses, the paramedics, everybody did their job. They brought these patients here. Nobody died at HCMC. Everybody got treated. And it was an unbelievable feat and an unbelievable example of how these folks are ready for anything. They're the best in the world. They're the absolute best in the world. And we're saying to those folks, we don't trust you. Dr. Hicks, you can't be on this board because we don't trust you. Can you think of anybody in the state of Minnesota who's probably more qualified in terms of who should get care and how we're going to get care and how we're going to deliver care than these folks? Do you really think that there's anyone else more qualified in the state of Minnesota? But we're saying, doctors, we don't trust you. We don't trust you. The same folks that built the best health care system in the country and in the world, that is the envy of the world, we're saying, we don't trust you. We don't trust you. Politicians can be on the board. Union members can be on the board. We understand health care. We can do this. We don't trust you. That's not a very good message to send forth to the people who've really built the best health care system in the country. I think we can do better. Small business folks understand this is not going to help your position. We've got a position where we've got government versus private market. We're not going to help. I hope we do. I hope this works, but I'm not very optimistic about the chances of that happening. So members, as we vote this out and vote this forward, please understand that what we need to do is we need to think about improving this from henceforth, and I hope we can do that. These are the kinds of bills and these are the kinds of agencies that once they're there, they're very much permanent. So I know that that's going to be hard, but I hope that you all are thinking very clearly and very cautiously about your vote today. And I thank you for your time and listening to me here. And I ask that you do not support this bill.
Representative Erdahl.
Thank you, Mr. Speaker and members. We've been learning a lot here tonight about Irish and Vikings and 50s television. And I could go on with a lot of topics as well, too. In fact, I've been waiting. I have a 3-hour speech in me. I really do. And I've been waiting for 11 years for a member of my leadership to come over and tap me on the shoulder and say, it's time for that 3-hour speech. I'm ready. But nobody asked me tonight either. So I'll get to the reason that I've actually stood tonight. In a moment, I'm going to ask Representative Atkins to yield, but I appreciate the cautioning from Representative Dean, because I recall now the last time I asked Representative Atkins to yield for a question, he almost took down the cheeseburger bill. So be careful with what you hear. But I do have a question that has come from my home area. And Representative Atkins, would you yield, please?
He will yield. Representative Erdahl.
Representative Atkins, how many jobs will the health care exchange and Obamacare cost Minnesota?
Representative Atkins.
Thank you, Mr. Speaker. In light of the hour, Representative Erdahl, I'll try to be brief, but my hope is actually that it will help small businesses create jobs. That's not my opinion. That comes from a group called Small Business Minnesota, and they are desperate for something to help them be more competitive and have more leverage when it comes to purchasing their health insurance. And I know groups like the Chamber of Commerce and the Business Partnership populated their boards with insurance companies and so on. This is a very difficult bill for them to support. It's a very easy bill for this group. Several hundred businesses represented by smallbusinessminnesota.org is their website if you want to go to their webpage. And what they've indicated is that this will help them add jobs. No different than my little business in South St. Paul. One of the biggest expenses that we have is health insurance costs, and we have no leverage against the giant insurance companies. They're not jerks. They just have all of the power. And so for us to get competitive bids is virtually impossible. And that's why having this opportunity to have apples-to-apples comparisons, trying to find something that will work for our business and provide high quality at a reasonable price. And according to the modeling, it shows about a 7.5% reduction in costs for health insurance premiums for businesses. We expect to put that right back into the business and hire more people. So far from costing jobs, we certainly expect it will allow us to add jobs. And thank you for the question.
Representative Erdahl.
Thank you, Mr. Speaker and Representative Atkins. And I hope you're right, Representative Atkins. But I have serious doubts about that this is going to save us. I think it's going to cost us money. As Representative Gruenhagen said previously, he was getting email from school districts in his district. I'm getting email from schools as well. I'm sure that most of you are. One of my school districts said it's going to cost them $200,000, and the business manager guaranteed that they're going to have to cut employees. And so I hope you're right, but that's not what I'm hearing, and I have serious doubts. Thank you.
Representative Lomer.
Thank you, Mr. Speaker and members. Others have been up here tonight with lots of facts and figures, and I'm not going to repeat any of those. I just want to say that I ran for this office because I love the state of Minnesota, and I love the freedoms that we have, and I see them slipping away, and this health care bill is just one more example. I'm going to talk more about, on a personal level, a personal story. 31 years ago, I gave birth to a son named Nick. He was born with spina bifida. I don't know how many of you know about that, but it's a quite significant birth defect, and over his 31 years, he's had over 70 surgeries. We've actually sort of lost count now. But I have been so thankful over the years to have lived in a country that has such phenomenal health care, and in a state that has such phenomenal health care. The best in the world. He's doing very well today, despite of all that he's been through, and because of all the surgeries and the innovations and the wonderful things that he's been able to have, like shunts, which prevent hydrocephalus, which is something that 50 years ago a child would have died from. So I'm very, very grateful. Today he works at Gillette Children's Hospital. He works with kids who are having multiple surgeries like he's had, and he's a very valuable employee there. I don't know, some people here might have even met him. If you have any kids or grandkids who have ever been to Gillette in the last 10 years, he's probably gotten them ready for surgery. Why do I mention this? Why do I talk about my personal experience? Because I am afraid that through this exchange and through what we're doing right now, we're headed towards a government-run system like Great Britain and Canada have. And I know that if my son had been born in one of those systems, he would not be with us today. There just would not have been the funds for surgeries of that number. And actually, several years after he was born, I had cancer and went through chemotherapy and surgeries. And again, I'm just so very thankful that we live in this state, in this country, where we have such an amazing healthcare system. So the whole idea of the exchange, to me, is a monumental bait and switch. I hope I'm wrong, but I see 2014 and the federal government taking over this exchange that we've set up, that we've paid for, because they don't have the money to pay for it, so we've done all the work, and now they change the rules. The federal government will be able to do that. This bill is about costs, it's about access. We will have less choice, it will cost more, and privacy, we will have none. You know, you were all laughing earlier with Representative Gruenhagen speaking, and I was having a hard time with that because this isn't funny, members. This is very, very serious, what we're doing right now. Think about your futures, members. Think about your families. If you don't have health, you don't have anything. 5, 10 years down the road, or tomorrow, you may look back at this vote, this decision, and think, I played a part in destroying the best healthcare system in the world. I hope you don't have to do that. You don't have to vote for this bill tonight, members. You can think about this. We can work on this more. Let's please keep working on this and vote no.
Representative Howe.
Thank you, Mr. Speaker. And if it's one thing I've learned in the military, it's speaking and briefing to generals is you be brief. So I'll be brief here tonight also. I'd like to talk, I'm going to bring up some of the things that we had discussed in committee. One of those things that we talked about was privacy. And I asked the question, what happens if I start entering my data and I start going into the exchange, and there's certain segments you enter some information, and then you get to the next segment, you enter some information, you get to the next segment. Well, what happens if I get 2 or 3 stages in and decide, you know what, I don't like this anymore. I decide I'm not going to get my insurance out of the exchange, and I'm going to get out. What happens to my data? Your data stays. Why does it stay? I'm not quite sure. But that data stays in the database. That's going to be quite a large database. And my concern is, and we had some testimony that said that, they went to a clinic 30 years later and their data was still at that clinic. Well, you know what? That's a good example of good security and good data privacy, because you had no idea that was still there. But it was. They actually had the insurance card. But I'm not convinced that my data that the government keeps is secure. I've gotten letters notifying that my data's been breached no less than 4 times. The confidence level for government keeping my data private isn't very high. And then let's talk about how many options we're going to have. Currently, right now, I'm told that there's over 700 options that you can have for health care. And who do we go to navigate those 700 options? I go to my health insurance agent. He helps me navigate that. My neighbor helps me navigate that. Actually, my brother helped me navigate that. But what are you going to have now? You're going to have less than 10% of that. You're going to have less than 60 of those choices. And who's going to help you go through that exchange and navigate her? Someone that's not licensed, not bonded, not insured. And he's going to have you help you navigate that insurance exchange. And I wasn't even going to get up to stand up and talk until Representative Scott said something that prompted me to get up to speak. And I need to have, if Representative Atkins would yield for a question.
He will yield. Representative Howe.
Thank you, Mr. Speaker, and Representative Atkins. Just earlier, you replied to Representative Scott that the oversight of this agency is going to be second to none. That the OLA and the Oversight Committee is going to make sure that they toe the line. Well, my question is if this is such a great deal and they're going to oversight this health care exchange so well, why does every other agency submit their budgets to this body and get approval? Why is this one so special that they don't get the same scrutiny from this body that every other agency does. Can you explain that to me?
Representative Atkins.
Thank you, Mr. Speaker. Representative, actually, I think they'll get greater scrutiny, so I appreciate you raising that point. There is going to be no entity that gets greater scrutiny than the Minnesota health insurance marketplace, particularly in the first several years, I would imagine, not just by the legislative auditor, not just by the fact that it's subject to a federal audit as well. Our audit, the Legislative Oversight Commission, the LCC, this new legislative commission that was adopted in the conference committee, in addition to the normal powers that this body always has, plus the normal powers that the executive branch always has to intervene, plus just criminal law and all the various other civil penalties that would be involved. Like I said, I think it's the most scrutinized entity that's ever been established.
Representative Howe.
Thank you, Mr. Speaker. Would the good Representative Atkins yield for another question?
He will. Representative Howe.
Thank you, Mr. Speaker. And Representative Atkins, if that is the way to do business, then why aren't we doing that with every other agency? Why not go the same process for every other agency, if that's such a great process?
Representative Atkins.
Thank you, Mr. Speaker. Representative, because you all didn't want this to be a state agency. I've tried to build this in such a way so that folks would, every time we do something and incorporate what suggestion is made, then there's a reason for not doing it that way. People didn't want this to be within the state, run as a state agency, so we've tried to build it as kind of a hybrid akin to a PUC or Minnesota Zoo Board, things like that, so it has a little bit more entrepreneurial, market-driven element to it. If you want it to be a state agency, you can certainly propose that in future legislation, but I kind of like it set up as a more entrepreneurial, competitive type venture.
Representative Howe.
Thank you, Mr. Speaker. Well, what I'm concerned about is just what you said. It's competitive. It's competitive with who? Who is this exchange competing with? If I remember what was said in committee, testimony in committee, I think the committee heard that this exchange is in competition with the private market, if I'm not mistaken. I believe that's what the testimony was. Why should our state government be in competition with private industry? I think that's a mistake. And the other thing I'm concerned about is what's the consequences of this agency going awry? Who's going to hold their feet to the fire but the OLA and the Oversight Committee? Who's going to challenge and make them pay the consequences of doing wrong and being abusive with their budget? Members, I think this is a big mistake, and I hope you vote no, send this back to conference committee, and let's make this thing right. Thank you.
Representative Hertas.
Thank you, Mr. Speaker. Well, we've heard quite a bit tonight, and I too am concerned about the choices that we have for our consumers. You know, we've had quite a good experience with corruption of our English language in recent years. A marketplace. Well, I think every one of us has a different idea, perhaps, of what a marketplace really is. But how is it a marketplace when we're subsidizing every purchase in this exchange? That's not fair competition, as Representative Howe has said. I mean, essentially what we're doing with this subsidy to 400% of the poverty level, we're encouraging everybody to abandon the private market and buy their insurance on this exchange. There won't be a private market. And you're talking about choice. I understand that we're talking about having the same criteria, the same minimum qualifications in order to sell this product on the exchange. Transparency. I don't know how it's transparent when we have a 7-member review board with academics rather than qualified professionals and providers really guiding the system of what's going to work best. Academics and politicians versus people who really know about health care and health care delivery. The second item is cost. We've already talked about the fact that if we subsidize the purchases, there will be no competition. We'll be driving it out. The cost will be whatever all of these people on the exchange decide it will be. We've already heard that the NFIB, who was on board in the beginning, says it's going to cost more money. It's going to cost businesses a lot more money and cost jobs. We've also heard from the Minnesota Chamber of Commerce. They too were on board initially, but they've concluded the same thing. We've also heard from the Gruber-Gorman report, who predicts that this will be double-digit increases in expenses within a few years. Notably, doctors in my district have been sending me emails like crazy, especially after this Gruber-Gorman report came out, 4.5 hours after the close of deadlines on the Friday before we heard the bill. I had to tell all of my constituents who had comments about this that I'm sorry, I can't be your representative anymore because your good ideas are already past the deadline. Really frustrating. And we talk about transparency in this body. We just won't be able to afford all of the mandates that the academics and the politicians on this 7-member board are going to put on it. Then there's the issue of privacy. This bill has a license to really share all of your personal data. When our second child was born, she was born with a TE fistula, a life-threatening condition. It required immediate surgery. As a young couple, we ran up $250,000 of debt right away. And all of the information about our child, do we want that shared with all the databases? This is what's going to happen. And if you don't think it's going to happen, our own Minnesota Department of Health members has been collecting your grandchildren and your children's baby DNA. If they're under 14 years of age, MDH has your family's DNA records on file. It happens. It really does. Probably the most serious thing, and I thought we had a great debate before when Representative Fritz offered an amendment and added the prohibition of abortion onto this bill. This bill offers taxpayer subsidies to people who buy these policies on the exchange. And for many taxpayers, these taxpayer-funded subsidies are morally wrong. So the way I see it right now, what we've done is you've got two choices this evening. One choice is to kill this bill. The other choice is to kill the unborn. Thank you.
Representative Albright.
Thank you, Mr. Speaker. I had a long conversation with my wife after my last floor speech, and she made a comment to me that resonated with me, and I've thought long and hard about it. But she said, you know, I listened to you on the floor that night, and you made some very good points. But Tony, you seemed really angry. And is that the legacy that you want to be remembered by when the time comes for you to leave this chamber? And so I'm sitting here and I'm thinking about the legacy that we all will leave here with, and I point to House File 5. Representative Atkins, I will congratulate you. You have suffered the slings and arrows of everyone on this side of the aisle, and you've done it with humor, you've done it with wit, and you've done it with clarity. And so I tip my hat to you as a worthy spokesperson for this bill. But I can honestly say, and I hope it's true, I wonder what kind of a legacy they will think on for you. I hope it's a good one, but unfortunately I can't be in that camp right now. And so as you think about the legacy, members, of what we're about to embark on as a journey or as an adventure, are we willing to leave a legacy of increased taxes on our citizens because of implementing this piece of legislation? We're going to increase premiums by 3.5% legitimately. that's going to go towards the costs for those that, in some cases, can ill afford them the most. So I worry about that. I worry about the legacy of them remembering what happened in 2014 when this all started to take place. I also wonder what kind of a legacy we're going to leave for the folks that are going to be utilizing this program in the coming years when they recognize that accessibility to physicians has been curtailed. We listened in policy committee yesterday about market rules and how the geographic dispersion for providers is going to be mandated. That concerns me. I know it's well intended, but when, as Representative Dean said, we are the leader in healthcare providers in the nation in terms of getting after it and doing what is needful for our patients. And I just wonder if the legacy that we're embarking on is to limit the choice and the geographic availability to physicians and to physician assistants and to nurse practitioners and to those that care very dearly and deeply for their patients on a daily basis. I wonder about that as our legacy. I wonder about the choices as our legacy. And I draw your attention to, because words have meaning, and I draw your attention to the words active purchaser. Does it really mean what we say? To me, it's a bit of an oxymoron. Rather than people having true freedom of choice, from 700 down to less than 60, really? Does that really define itself as an active decision, as a true choice in the matter? And it's especially compounded in my mind when you think about the fact that those choices are being provided to us by 7 people. 7 people, members, that in my vernacular may not have the intellectual capital or experience to really be able and capable of providing value-added commentary to the choices and to the pitfalls in the choices that are provided to those people that are seeking desperately to use the exchange for health care for themselves and for their family members. Are we willing to leave that as a legacy for ourselves? And finally, members, I think about the accountability that we're setting into motion in terms of the oversight, in terms of the denial of availability to reputable people to sit on this board. I've had some conversations, and it struck me as very odd that the only way by which you can remove a member from this board is for a cause of action. By the time that you identify a cause of action, it may very well be too late to remedy the situation for those that are using it. Is that the type of legacy that we want to leave for our children? From a legal perspective, if you take a look at the preponderance of evidence in this case, I don't know that you would be able to convict us of doing a good job. I really don't. That's a legacy that I worry about, because at the end of the day, we're going to have to wake up someday in the future. It may not be next week, it may not be next month, it could be 2 years from now, when the affirmation that we get on a daily basis by working in this institution and by the respect that we have for one another wears off a little bit, and we start thinking in matter-of-fact terms about what decisions we made. Are we going to look back at this decision and think about it being a good part of the legacy that we provided for the state or not? I'll leave you with one conversation that I had with a very dear friend of mine about a month ago. He's a small business owner. We're sitting down and we're talking about this, and he's asking me, how's it going over at the Capitol? How's it going with that insurance exchange? He's a pharmacist, and so he's intimately aware of what's going on in terms of how it's going to affect his business. I took about half an hour to try and explain it as best I could. He sat back, he looked at me, and I've known him for 20 years, and the only question that he raised for me is, what's your backup plan? And I had to honestly say, I don't think there is one. So members, as you take this vote tonight, think about the legacy that you're leaving for your friends, for your families, and for those that have yet to be even graced in our presence in the state. And how will you be able to explain to them how you benefited or defended their life, their liberties, and their pursuit of their happiness? That's the Constitution, that's the Declaration of Independence that we all swear to uphold. I've said my piece, and so I'll sit down. But at the end of the day, it is a legacy that we all will share. Thank you, members.
Representative Zellers.
Thank you, Mr. Speaker, and members. And members, at the end of the day, you're going to have to ask yourself a question, and I'll ask it to Representative Atkins. It's the last one, I promise. And I'm with Representative Dean. I thought you said 56 states had already approved this and were on board, and it didn't cost anything, and they were actually making money on the deal. But he reminded me, and you got me there. At the end of the day, and I, unlike some of the other folks out here that sell insurance or been in it, I've worked on the Commerce Committee with you, Representative Atkins, for a long time, so I get enough of it to be dangerous but not lethal. So I went out and asked some insurance agents. And a guy who's been in the business for a very, very long time, I see him at hockey on Saturday mornings every so often, and so we're sitting there as I'm watching Will work on his left power turns and his right power turns and his slap shot. The only way I got him to get the slap shot off the ice is if I gave him $5, so $20 later after last weekend, so I guess it was a good thing. But I said, so as we go through the whole thing, he's read it, and he read the Gruber Gorman, and he said, I wish I was that guy, because I could have got paid $600. I would have done this thing for $500,000 and saved the state a couple of $100,000. But he went through the whole thing, and I said, so what would, if I said, you're down here on the floor with us, what would you ask? And his question to me, and I wrote it down, I'm not reading it, Representative Winkler, but I wrote it down. He said, at the end of the day, my biggest fear for you as a state, and he said, for me as an insurance agent, is, are we going to cover more people, and is it going to cost more money? He said, because the way I look at it, the model that's created, he said, I don't know how it is. So if I got to ask a question on the floor, he said, would be my question to the author of the bill. Where in the bill does it guarantee those two simple things? Cut out all the oversight, cut out the board that's appointed and unelected and can make all kinds of money because they're unclassified, all the stuff. He said, at the end of the day, where in the bill does it guarantee that more people will get covered and that health insurance costs won't go up? So, Mr. Speaker, if he would yield on behalf of my constituent, Representative Atkins would yield, that would be my question.
He will yield. Representative Atkins.
And Mr. Speaker and Representative Zellers, I have a great deal of respect for that question and for your constituents' concern. The best that I can do, and being very genuine, is to tell you that we live in a country where we promote competition, where it leads to great things, whether that's competing to get into a good college, whether it's two businesses competing against one another for the same customer. That's what competition does. It drives quality up. It drives prices down. I believe in that model, and I think you do too, Representative Zellers, and I hope and I pray that it works with respect to this health insurance marketplace that we are establishing.
Representative Zellers.
Thank you, Mr. Speaker, and thank you, Representative Atkins, and I do believe you're sincere, and along with my freshman colleague, I think Tony's right. You've done a heck of a job, and I won't talk about you walking an ugly dog with warts around the Capitol, because that's not fair to the dog. But at the end of the day, there's a lot of things, and freshmen will get this, second-term members are starting to get it now. When we pass bills, we get things called runs. And my freshman year, I got here late, so everybody got the real long explanation from Ed Burdick, who is an icon here in the Capitol and actually all across the country. And they explained how this is a run and how you introduce a bill. So I got here late, so I didn't get all that. So when I sat down right where Representative Kiefer's sitting, we were going to get ready to vote, and I got put on the tax committee as a freshman, and I thought, my God, I must be really good if I get put on tax committee my first term down here, and I didn't even ask for it. And Representative Abrams handed me a run, and it was all these tax things, and it was an LGA formula run. And he said, Representative Zellers, congratulations, welcome to the tax committee. Now, we're going to expect you, when you get to the tax committee, to be a team player. And I'm now going to explain runs to you. Well, by the end of the conversation, everything after that I glossed over, but at the very end he said, and that's what's going to happen to Maple Grove. I said, well, wait a second, back up just a little bit of the tape, not to the very beginning, but just a little bit. He said, yes, you're going to vote to eliminate Maple Grove's LGA. It's about $137,000, and you're going to take that away. I said, well, that doesn't sound like a good idea. I said, I just got here, now I'm going to go and cut my own city's LGA? Yes, that's what it's like to be a team player. So very quickly after that, every time somebody gave me a run, a sheet of paper with all kinds of math on it, I thought of Representative Abrams saying, Representative Zellers, welcome to the tax committee. So when runs come out, when people hand you things, whether it's education, whether it's health care, whether it's tax policy and LGA formulas, you really should take a look. And when this bill came out, in fact, Mr. Speaker, could I ask just, and it's not a malicious question, I just want to ask a couple questions to a couple members, if that's all right. Would Representative Halverson yield to a question, Mr. Speaker?
She will yield.
Thank you, Mr. Speaker. And Representative Halverson, I'm just wondering, as we're going through this thing, and we've heard all it's passed 57 states, 90% of the people like it, and we're going to make money on the deal. Have you been given a run, or do you have any idea how many constituents in your district are going to be covered with this insurance, and how much money other constituents are going to save on this?
Representative Halverson.
Mr. Speaker, it sounds like you're asking for a specific number, and I don't have that specific number.
Representative
Thank
Zellers.
you, Mr. Speaker. And maybe I'll try a border state. Representative Lean in the Moorhead area, so you're going to see some competition from across the way. Have you been given a number? Do you have an idea in studying this bill? Have you talked to Representative Atkins or Representative Huntley, somebody in the Health Care Committee, so you know exactly how many of your constituents are going to see coverage and how much those that aren't in the health care exchange or who are part of the small group insurance market that are going to save money on this health care exchange, if he would yield, Mr. Speaker?
He will yield. Representative Lean.
Thank you, Mr. Speaker. Representative Zellers. From what I understand, the number of folks statewide who will newly be covered is about 300,000.
Representative Zellers.
Thank you, Mr. Speaker. And one more, maybe. Representative Sawatsky, if she would yield to a question. Not in her chair. Oh, that's all right. How about Representative Savick? Would she yield?
She will yield. Representative
Thank
Zellers.
you, Mr. Speaker. It's just the same question, Representative. If you know specifically how many people in your district will be covered, how much money they'll save, and then how much money those that aren't going to be receiving coverage will save on their health care insurance premiums.
Representative Savick.
I'll just have to repeat the answer. I know that 300,000 people in Minnesota will be covered that aren't currently, but how many in my district, that I don't know.
Representative Zellers.
Thank you, Mr. Speaker. And I think you all get the point. We come down here and we vote on things based on facts, based on numbers, based on what it's going to mean for constituents in our districts. At the end of the day, you're going to be taking a vote today on a hope and a prayer that this works. As Representative Albright said, what's the backup if it doesn't work? Is there anywhere in the bill? I looked, Representative Atkins very honestly said there is no place in there that guarantees everybody will be covered and everybody will save money. Because at the end of the day, numbers are numbers. Everybody can use numbers for their benefit, to use against somebody else. But at the end of the day, if you're not going to cover all Minnesotans or more Minnesotans than currently receive coverage, and you're not going to save money for those who are currently paying the system, and are going to see a tax increase or 3.5% premium charge, nice way to say tax increase, then are you willing to take that vote today based for your constituents who you represent now and for the future constituents and roll that dice? I think at the end of the day you've got to ask yourself, are we going to be back here 2 years from now and is this the e-pull tabs of health care? Are we going to come back here and have 4 or 5 or 3 or 6% show up when we were hoping for 80, 90%, and then what's the backup plan? Is it a soup can collection? Is it pop cans? Is it going to be another tax increase? That's what will end up, members. And are you willing to roll the dice on less coverage, higher cost, and less privacy? And if you do, Godspeed, go forward. I'm not willing to make that bet on behalf of my constituents, on behalf of my kids, on behalf of the people that I represent. Because I don't know those numbers either. You could ask me the same question. Any of you could say, how many people in your district are going to save money? How much of their health insurance costs are going to go down? How many people who don't have coverage now are going to get covered under this bill? I would give the same answer. I don't know. None of us know. 300,000 is the number. Representative Gruenhagen already gave it out. 6% of the 9% can already get coverage and choose not to. Senators, I'm not willing to make that gamble. I suggest you not make that gamble either on the House floor. We've all made promises to our constituents. I think the first and foremost is to do no harm. And if by voting for this bill you think you're going to do harm to the constituents in your district, I suggest a red vote. Thank you, Mr. Speaker.
Representative Holberg.
Thank you, Mr. Speaker and members. And well, certainly I appreciate the kind words of the bill author. It's my understanding that my name was also mentioned frequently in other committees and conference committees. And so I would be remiss if I didn't stand today and share my thoughts about this bill relative to an individual's privacy, the standards we have in the state of Minnesota, and the lack of standards at a federal level. When this bill was introduced, it really made me scratch my head, because I knew we had already committed tens of millions of dollars of federal money to build this massive database, nothing like it ever seen in the state of Minnesota before. And quite frankly, maybe even the bill author would agree with me. The initial provisions in this bill related to medical privacy and data practices were ill-informed, poorly written, and reflected nearly a complete lack of understanding of Minnesota Chapter 13 and our privacy standards. So you got to begin to wonder, when they put the bill together, if it was so bad, is there anybody in their organization, as it exists today, planning for this massive database that has any expertise in privacy? I wonder. Certainly great strides were made. I would say it's about 80% there. Minnesota prides itself in being one of only a few states that has higher medical privacy laws than the federal HIPAA law, at least from now. There's a bill actually introduced this year that would undo that. And some of you that have listened to me over the years related to data practices hear me talk about the Mack truck exceptions. Big, huge exceptions in law that you can drive a Mack truck through. Law enforcement has one that if they can deem it for investigative purposes, they get access to virtually everything. And you got to watch out for those Mack truck exceptions, because invariably people will find them and use them. In the case of this particular bill, the Mack truck exception is listed on page 18, line 1, where it talks about access to data either by federal law or it says, I got to get my glasses, I'm sorry, according to state or federal law, specifically authorizing access to the data. Now, why should that concern you? The federal government, they'd have good privacy protections, right? They'd take care of us. We can trust them to take good care of our records and reflect Minnesota values. Well, one of the things, let's see what they have already on the books and how they work. We have something called the Driver's License Privacy Act, which many privacy experts should say that it should actually be the Driver's License Lack of Privacy Act, because what it actually does is it lays out more than a dozen exceptions to an individual's right to privacy for their data records, allowing access to private investigators, lawyers, tow truck drivers, etc. Similarly, the federal HIPAA law, in large part, doesn't really guarantee any privacy, but rather makes it easier for health plans to operate and requires sharing data for payment purposes, etc. But again, we in Minnesota have a higher standard than they do at the federal government. So my question, it makes me nervous. I would say maybe we're about 80 to 85% there. But if you really, really cared about this stuff, and if you write a really good data practices bill, what you want to do is you want to identify the individual data sets that will be collected, how they'll be used, who has access to them, and for what purposes. And certainly there are elements of this bill that do that, and I appreciate that. I think that we made remarkable progress from the bill as introduced. But I'm afraid of the Mack truck exception in this bill. And so then I asked myself, okay, if they really cared about data practices, then shouldn't somebody on this appointed board have expertise? How are we going to ensure that this is an important issue? And while I recognize that the bill author cares about the issue, at a certain point the people that he was working with were unwilling to go any farther in concessions in fixing this bill from when it was introduced. So I appreciate the changes that were made. I think that we will need to be very vigilant on the use of this. I beg and implore the people that are going to put this system together that when they make their contracts for data sharing with other entities, they take that principle of data practices within the contract concept and identify specific data sets for specific purposes and make the details of those contracts public so individuals know how information about them is being used. I am very nervous about this. If you look at the proliferation of stories in the paper recently about unauthorized access to data and the fact that we know that there is going to be interaction with the IRS, Minnesota Department of Revenue. There are lots of opportunities for abuse. And I hope that I'm wrong, that this works, but my fear is that the Mack truck exception and the lack so far of people involved with this process that really have an expertise in data practices makes me very nervous that we are going to be back in very short order trying to clean up problems related to data practices, privacy, and this healthcare exchange.
Representative Doubt.
Thank you, Mr. Speaker and members. Last week, this bill was bad when we discussed it then. This week, it's worse. We lost some important provisions in this bill that didn't come back to us from conference committee. And obviously, the matter before us right now is adoption of the conference committee report. So you know it's not too late. We can still send this bill back. We've still got time for the conference committee to make some changes and make this bill a bipartisan bill, a bill that's good for Minnesotans, a bill that helps Minnesota companies be more competitive and helps keep the costs for their employees, for their health care down. Some of the things that we lost in conference committee, there was actually a provision in this bill that said that legislators would have to get their health care in the health insurance exchange. That's gone. That came out in conference committee. Another one that we put on in this body, we lost a provision that would allow you to keep your doctor, not you, but people who will be participating in the exchange. People won't have that ability anymore, or not at least a guarantee for that ability. We lost language that would prohibit abortion from being included in the essential benefit set. And we lost the House position on active purchaser. So now, a 7-member board will be able to decide arbitrarily which plans will be included in the exchange. This final version that came back from conference committee also maintains the conflict of interest language, and that sounds good. The problem is it prohibits doctors, nurses, brokers, and insurers from participating on the board. What does that mean? The people who know the most about this won't be able to serve on the board that governs how this whole thing is going to work. We've got a 1.5% premium tax in the first year that'll go up to 3.5% after that first year. That's an increase in cost to plans that are in the exchange and the plans that are out of the exchange. That's an increase in the cost of health care in Minnesota. Last week, the governor himself referred to this as a big gamble, and he said he wasn't sure if anything this big could work. Members, one last time, I'm going to implore on you, vote against this motion to adopt the conference committee report. This bill isn't ready for prime time, and I don't want to miss this opportunity to agree with the governor. This is a big gamble, and we can still make it better. This bill will increase costs for health care in Minnesota. It'll give less choice to people in choosing their health care plan. And there's no protection for their most personal and private data. Please vote no on adoption of the report.
Representative Atkins.
Thank you, Mr. Chairman, and thank you, members. And I appreciate your patience and your perseverance, certainly your passion. I think it's fair to say that we definitely agree on one thing, and that is we are, in fact, making history tonight. This is, without a doubt, the most significant health insurance reform we've seen in Minnesota in 50 years. As Representative Huntley has said, not since Medicaid or Medicare in 1965 have we seen anything this significant. And members, whether you vote red or you vote green, you're not wrong. I respect that you are voting your conscience, and whatever you decide to do, I think that's the right thing for you to do. I am hoping that I am, in fact, on the right side of history this evening, and I think the facts argue in favor of a green vote, and they are abundantly clear. If you look at the model that we used for this in Massachusetts, all across the nation, according to the New York Times, they were seeing increases in health insurance costs, double-digit increases in health insurance costs. Yet in Massachusetts, the price was going down by 20% for individuals, by 40% for families. Why in Massachusetts? Because Massachusetts had a health insurance exchange, Governor Romney's health insurance exchange. If you look at our alternative, which is a federal-imposed, federally run exchange, there's 4 differences between what we're proposing here and what the feds would do. This is more affordable. It's a third of the cost. It's more private, has more secure data and more severe penalties than any other entity would impose for any other data privacy breach in Minnesota history. It has more local control, specifically 7 Minnesotans running this rather than having it run by the Department of Health and Human Services out of Washington, D.C. And finally, it's got more oversight, as I alluded to before, more oversight than any other entity of this kind in the state's history. And I won't go into all the details because you've probably had enough of that. But more importantly than all of that, and the thing that I would finish with, is that we're talking about 1.3 million Minnesotans that will be able to purchase. That's the modeling. Those are the numbers that we have. As members, Representative Halverson and Lean and Swatsky, Savick indicated, there's 300,000 currently uninsured Minnesotans who will maybe for the first time in their life And Representative Lomer, you talked about how important it is to have that coverage for your son, and that touched me. There's some folks that for the first time in their life, as a result of this exchange, will be able to get coverage and get the sort of care that your son got. That's important, and for that reason I hope that you will join me this evening in being on the right side of history and voting green. I'd appreciate your support and appreciate your attention this evening.
The clerk will take the roll on adoption of the conference committee report. The clerk will close the roll. There being 70 ayes and 63 nays, the report is adopted. The clerk will give the bill its third reading.
Reading, House File 5 is amended by conference.
Third reading. Representative Fabian. Okay. Representative Fabian.
Thank you, Mr. Chair. I'll be very brief, members. It's been a long day, obviously, and a long week. I just want to point out the fact that, this is just my second term. For 2 years, I've been here in the House, and the rules for getting a bill signed have been pretty clear. Bipartisan authorship, bipartisan votes. I'm sorry this does not pass that test, and I'm concerned that the rules have changed. We can do better as a group than we're doing tonight. I'm going to leave you with this. Rural members, on this bill, I want you to keep in mind that you are going to see higher rates according to the proposed map that was handed out here on the House floor last week. Kitson County, Marshall County, Roseau County, Pennington County, all those counties are being pulled down into the metro area. Roseau County, those counties are being brought down towards the metro area. Lake of the Woods County and those counties are being brought down to the Duluth area. When you ask your local insurance agents why that's happening, it's because we have low rates, they have high rates, and that's the way you can balance them out. Vote red.
Representative Mack.
Thank you, Mr. Speaker and members. Well, we are at the inevitable hour, members, and while I was certainly hoping that when we got to this point, this bill would be in a much different shape than it is in. We had a lot of good discussions through the process, a lot of good ideas come forward, a lot of proposals to make this better, and while we got some small wins here and there, in part thanks to members on this side, in part thanks to members on your side and the hard work of Representative Atkins, but it simply just it doesn't go far enough. And there's a lot of doubts and questions that have come up by a lot of members. I can't say that I totally followed the response from Representative Atkins regarding the oversight issue and why we don't expect this exchange board and its massive budget to submit to the legislature for approval the money it's going to be spending and what it's taking in on behalf of taxpayers. And there's a lot of unanswered questions, members, but the things I just want to focus on as we close here tonight is the three biggest things that I think should be a concern for Minnesota citizens and certainly for us as decision makers. The issue of less privacy. Representative Holberg expounded on that quite a bit. I don't need to add a whole lot more. But the fact of the matter is, members, is that there is going to be a great deal of data collected, new data that's never been collected before. And the fact is we're not assured of what's even going to be collected, who is going to have access to it and where it's going to be stored, and how proper notification is going to be given to all of our constituents in this room. It's a huge unanswered question, members, and from this point forward we're going to be leaving those critical decisions in the hands of an unelected board with the exchange. That's a huge reason for me why I cannot support this bill. Members, the issue of cost has come up, and I don't think any of us can deny that costs will go up in some way, shape, or form, just on its face at the 3.5% withhold that people are going to see in their health care costs. But members, I'm hung up on an issue that we talked about a little bit earlier tonight on page 9 of the bill, where it talks about the $20 million cash flow assistance that the Commissioner of Management and Budget can offer to the Exchange Board. And members, as I look at the latest fiscal note that we were working off of last Monday when this bill passed off the floor, I'm looking at fiscal year 16 and fiscal year 17, members, where it's showing that the exchange is going to be running a shortfall of $9.4 million and $4.6 million. Now, members, I'm thinking about this cash flow problem that we could possibly run into that would require the commissioner, or not require, but at least give the option of borrowing $20 million to the exchange to bail them out because the numbers just weren't working, as many of us are concerned will be the case. Members, I'm trying to relate that to a real-life situation, figuring out what bank would loan money to an organization that has such inflated spending and unfettered spending as this exchange board is going to have, see the shortfalls they're running and say, sure, here is a huge sum of money to fix your cash flow problems. Oh, and by the way, all this money is coming from the same pot of people, Minnesota taxpayers. Members, it is a bad deal for us as decision makers and people who are trying to represent the people back home. That is a huge hang-up for me. And we've asked a lot of questions about these numbers, projections, but if you line up a lot of these issues, members, and particularly the shortfall issue that we clearly see on the fiscal note, it's undeniable. There are red flags all over this thing and no answers to remedy many of the questions that we have to give us any assurance that we are not headed for a huge pitfall that's almost unavoidable and is certainly going to mean higher costs for Minnesotans for an indefinite period of time. And members, on the issue of cost, I feel like I need to stand up for my constituents tonight. And I believe I could also speak on behalf, simply because of their proximity to my district. I have a pretty good idea of what the median household income is for Representative Morgan's district and Representative Halverson's district, where if I just run the numbers of what the average household income is, look at what the standards are in the exchange for whether or not you're going to be eligible for a credit or a subsidy, and if you're not eligible for a credit or a subsidy, what the Gruber-Gorman report and their expertise that Representative Atkins has been telling us about since day one, what that report says that if you don't get a credit or a subsidy, you're looking at least a 13 to 29% premium increase. Well, members, a lot of the people in my district will not qualify for a subsidy or credit based on their household income. The same is true for Representative Halverson's district. The same is true for Representative Morgan's district, just based on the statistics of those individual districts. So I can say with a fair amount of certainty, members, that a lot of my constituents at home will see significant increases in their health care costs. And it is terrible timing, members. They are trying to get back on their feet. We're dealing with a very fragile economic recovery. They're already looking at rising health care costs. This is going to do them no favors. And anyone else who has that situation in your home district where you know what the average household income is, you line that up with who's eligible for credits and subsidies, you're not doing any favors for your constituents, or at least the majority of them, by passing this bill in its current form. It's a bad deal for them, members. They're going to see an unaffordable situation coming at them, and they will have nothing they can do about it. And frankly, we here at the legislature aren't going to have a whole lot we can do about it because we've given all that power over to an exchange board. That's extremely, extremely concerning and should be for any member who sees that situation in their districts at home. Members, finally, on the issue of choice, two thoughts on this. One issue we've talked about is doctor. I had a constituent contact me saying, will I be able to keep my doctor if I go in there looking at their small employer going towards the exchange option? And I said, you know, that's a great question. They've had their same family doctor for decades. And I said, there are a lot of variables there, because the big question is who is your doctor going to be able to get a contract with in terms of an insurance company? And then the greater question is that plan that your doctor is contracted with going to be able to thread the needle that the exchange board arbitrarily puts together? And if all those things line up just perfectly, you have a chance of keeping your doctor. But if through this whole process that none of us can quite figure out or have really no clue as to how exactly the exchange is going to manage that decision-making process, if your doctor's in a network of carriers and that carrier got denied access for some unknown reason at this point to practice in the exchange, you could keep your doctor, but you can't do it through the exchange. You can't do it with that tax credit or subsidy that you'd be offered. So your options are either pay more, keep your doctor, or you're going to have to give up your doctor and be thrust into and forced into a system that you didn't ask for, you didn't want, and frankly is a pretty bad deal for you. That's a huge concern, members. Finally, the lack of plans in the exchange, members. We've heard a lot about competition, how we'll get the best of the best plans in the exchange, and how that's going to be good for Minnesotans. Members, it just doesn't add up. What they're going to have to do to get themselves into the exchange, the risk that they're going to have to take for no guarantee. We don't know how often the exchange is going to revisit their decisions, how often a plan is going to get another crack at the apple to get into the exchange. Will those rules change arbitrarily? So many questions that we don't know and we don't have any parameters over. Members, I don't think that the way it's currently set up, it is going to encourage competition within the exchange. I think we're going to see a limiting of options, therefore not a lowering of costs, but a raising in cost, members. I think the inverse is going to happen of what's been purported by the author of this bill and the proponents of this bill. So members, with that, those three critical points that I really hope all of you are asking, and maybe you've talked to the author offline, maybe you have assurances on these, but like Representative Zeller said, I am not willing to do this on a wish and a prayer. I do hope it works for the sake of Minnesotans, but in my mind it just doesn't add up. We have less privacy, more cost, less choice for the people of Minnesotans. Members, please vote no.
Representative Doubt.
Thank you, Mr. Speaker and members, and thank you, Representative Mack. I don't know if I can sum it up much better than that, but this is our last opportunity to say that this is the wrong policy for Minnesota at this time. As many have said, what we can expect from this exchange will be higher costs for health care in Minnesota. This bill will increase taxes on small businesses and working families by more than $60 million a year. And its budget will not be subject to legislative oversight. Members, I said it last week when the bill left here on its way to conference committee, but I want to say it again. And I'm very sad to say this is the first tax increase that you're going to pass out of this body this session. At a time when Minnesota's economy is growing, jobs are being created, we're going to take a step backwards and inflict pain on the people who are out there doing what they do best, creating jobs in Minnesota. This bill is going to provide fewer choices to people on their health care. How? A 7-member board of unelected people will decide arbitrarily which products can be offered in the exchange. And most importantly, this bill removed language that ensuring consumers in the exchange that they can keep their own doctor. There's no guarantee of that. And this bill falls far short of protecting the most personal, private patient data. We've heard from groups outside of Minnesota or outside of this chamber that represent businesses. They've sent letters into the chamber to talk to us about how they feel about the exchange. Groups that represent thousands of job creators in Minnesota. Chamber of Commerce says this will increase taxes on small businesses in Minnesota. And the bottom line, it'll make health insurance more expensive for consumers. They say this will limit consumer choice. And they say that this creates an exchange board governed by people without the experience needed to serve the consumers efficiently. That's the Minnesota Chamber of Commerce. Minnesota Business Partnership. They've got concerns too. The financing of the exchange, they say it'll add to the cost of insurance for those who already struggle to afford coverage for themselves and for their employees. They continue that this will limit choices for consumers. And they also have concerns about the governance of the board, saying there's no assurance that there will be any individuals on the board with the appropriate experience in the required areas. NFIB actually compared our exchange to that of Colorado, a state that's a similar size to Minnesota. I found out by reading that one that Colorado's got an exchange that's going to cost $22 to $24 million a year, a third of what ours is going to cost. A third, members, of what ours is going to cost. But it's not just Minnesota's businesses that are going to be hurt by this exchange. I was talking to one of the members in the chamber tonight who told me a story about a couple of their school districts that will suffer from the exchange. These are districts with approximately 1,200 students. The cost to them to provide the insurance through the exchange, and these are increased costs to these school districts, $200,000 a year. $200,000 a year. What was offered up from the other side was saying, well, they'll have the option. They don't have to go into the exchange. What happens if they don't? A penalty. $218,000 a year. What does this do? Puts a burden on our kids. And what did the school districts tell the member? They said they're going to have to cut paras in the classrooms to pay for the health insurance exchange. So not only are we increasing taxes on our small businesses and on working middle-class Minnesotans, but we're also going to put a burden on our school kids whose districts will struggle to pay for the exchange. The Democrats' insurance exchange, and that's what I'm calling it, members, because when the bill left here last week, you had one Republican vote. And I had high hopes. I thought when this thing went to conference committee, we'll work out some of these bad things. We'll take some advice from people who know how this is going to affect small businesses. There will be some common sense in that room. And it'll come back a better bill. Well, I was wrong. This bill was bad last week, and the Democrats' insurance exchange is worse today. Because I think today it's going to leave the floor without a single Republican vote. Not a bipartisan bill. Not how Minnesotans at home think and expect us to work together here today. You know what that means? Nobody compromised. Nobody said, you know what? We'll listen to your point of view. We'll put privacy protections into this bill, bipartisan basis. We'll make sure this doesn't increase costs on Minnesotans. We'll make sure that we ensure that this bill offers more choice to consumers. Nope, not compromise. This bill's leaving here on a party line vote. And not only does this bill increase costs for Minnesotans, it limits their choices in health insurance coverage and fails to protect their most personal, private patient data. And one of the most shocking things, members, and I said it earlier, we removed language in conference committee that would have said, we ourselves as legislators think so much of this program that we're going to get our own insurance through the exchange. Nope, we exempted ourselves. You know what that means? It means that those of you who are voting for this exchange know that this exchange isn't good enough for us. But for some reason, you can't admit that it's higher costs, less choice, and lack of private data protection aren't good for the rest of Minnesota. This is your last opportunity, members, to stand up for the people in your district and vote no.
Representative Atkins.
Members, thank you. I'd appreciate a green vote.
There being no further discussion, the clerk will take the roll. The clerk will close the roll. There being 72 ayes and 61 nays, the bill is repassed as amended by conference and its title agreed to. Motions and resolutions. There are copies of the non-controversial motions and resolutions online and somewhere else that I can't remember right now. I'm sorry. If there is no objection to those motions, they will pass. Seeing no objection, those motions are adopted.
Sanders moves that House File 591, now in the General Register, be re-referred to the Committee on Ways and Means.
Representative Sanders.
Thank you, Mr. Speaker. Members, Chair Carlson approached me this evening on the floor, asked that House File 591 go to Ways and Means, which I'm fine with. House File 591 deals with vacancy and nominations for partisan elections.
Seeing no discussion, all those in favor say aye. Opposed, no. Motion prevails.
Kelly moves that House File 1000, now on the General Register, be re-referred to the Committee on Commerce and Consumer Protection, Finance, and Policy.
Representative Kelly.
Thank you, Mr. Speaker. Members, House File 1000 simply was mistakenly sent to the General Register. It needs to go to Commerce, so I would move that we would re-refer that back to Commerce. Thank you.
Seeing no discussion, all in favor say aye. All opposed, no. Motion prevails.
Khan moves that House File 1291 be recalled from the Committee on Ways and Means and re-referred to the Committee on State Government Finance and Veterans Affairs.
Representative Khan.
Mr. Speaker, this is per the agreement with Representative Davids early today.
Seeing no further discussion, all in favor of the motion say aye. All opposed, no. The motion prevails.
Dorholt moves that House File 1480 be recalled from the Committee on Transportation Policy and re-referred to the Committee on Transportation Finance.
Representative Dorholt.
Thank you, Mr. Speaker. Both chairs agree that this bill has to be referred to Transportation Finance, as it has a fiscal impact and is for permits on overweight vehicles.
Seeing no discussion, all those in favor say aye. All opposed, no. That motion prevails. Announcements. Representative McDonald.
Thank you, Mr. Speaker. Point of personal privilege.
You can just make an announcement.
Very good. Thank you. Members, I have a proclamation by the good governor of our state of Minnesota, and with your indulgence, I'll quickly read it, please. Thank you. The State of Minnesota proclamation. Whereas professional photography is important in documenting and preserving our heritage and history for future generations to enjoy. And professional photographers capture precious moments, including great births, weddings, graduations, confirmations, and other very, very important milestones in our lives. Whereas the Northern Light Professional Photographers Association was founded in 1982, and its membership includes professional photographers and vendors from Minnesota, North Dakota, and South Dakota. And whereas The Northern Lights Professional Photographers Association annual convention is returning right here in St. Paul for the first time since 1982 for a weekend of education and networking, March 15th through the 18th. Now, therefore, I, Mark Dayton, Governor of the good state of Minnesota, do hereby proclaim March 15th, which it is right now, 2013, Professional Photographers Day in the state of Minnesota. Thank you, Mr. Speaker and members.
Representative Sanders.
Thank you, Mr. Speaker. Mr. Speaker, I move that the call of the House be lifted.
Representative Sanders moves that the call of the House be lifted. All in favor say aye. All opposed no. That motion prevails. Any further announcements? Representative Liebling.
Thank you, Mr. Speaker and members. I'd like to remind members that Health and Human Services Policy is meeting at 9 a.m. in room 5. See you in the morning.
Representative Kahn.
Mr. Speaker and members, this was actually an announcement for yesterday, but this is an important day for science and mathematics proclaimed by an act of Congress. And I would like to have you turn to Representative Savatsky, who will be a poster for the day today. This is what 314 is National Pie Day.
Representative Murphy.
Thank you, Mr. Speaker. I move when the House adjourns today, it adjourns until 3 p.m. Monday, March 18th, 2013.
Representative Murphy moves when the House adjourns today to adjourn until Monday, 3 p.m. on Monday, March 18th, 2013. Okay. All in favor say aye. All opposed no. That motion prevails. Representative Murphy.
I move that the House do now adjourn.
Representative Murphy moves that the House do now adjourn. All in favor say aye. All opposed no. The motion prevails. The House stands adjourned until Monday, May 18th, 2013 at 3 p.m.